This was led by an international consortium and published in the Lancet Neurology end of January in 2023, so roughly 3 months ago. And this was the first attempt to propose diagnostic criteria for an old and on the same hand, new disease, MOGAD, that is, of course, as the name says, defined by an autoantibody to MOG, to myelin oligodendrocyte glycoprotein. And the key point here is that when certain core clinical criteria are present and the antibody in serum meets, or the assay for the antibody in serum meets certain titer and assay quality criteria, so cell-based assays with certain cutoffs or certain titers, then you can easily diagnose MOGAD with just one clinical event. In case the clinical presentation is slightly more elusive and there is a lack of information on the antibody assay and titer, then you would need additional criteria, either clinical or imaging criteria, for a patient then meeting the diagnostic criteria for MOGAD. So I think this is a great step forward. We are now looking at various cohorts in different countries, how these diagnostic criteria apply to these cohorts, how many of these presumably, MOG-diagnosed patients indeed meet these diagnostic criteria, and a couple of other issues that need to be addressed then.